What's up, guys? Josh and Dave here, just chatting a little bit this morning about some interesting stuff we're talking about. We were just talking about, we do a lot of stellate ganglion blocks for long COVID, for taste and smell disorders, but we were asked the question the other day, what else does it treat? I don't know that there's enough time to go through all that. I mean,
yeah,
geez, it's crazy. We were just kind of sitting there naming off things. Interestingly enough, everybody that comes in to see us, when they fill out the intake form of, what symptoms are you having, rank all your symptoms, and we've got this box of symptoms that we can rank 1 through 10. Almost everybody that sees that, they're like, oh my gosh, yes, I do have fatigue. My sleep is affected.
Yeah.
I do get dizzy when I stand up. I do have, all these other symptoms, and it's like we're treating all these things that people didn't even quite realize or quite put together that, may or may not have been from COVID, may have been from a prior viral infection, a prior illness, trauma, something that kind of set off the sympathetic response. But secondarily, all these symptoms are getting better.
We probably need to make sure people understand, there's been some disease processes, pathologies, that have been treated with these sympathetic nerve blocks, cervical sympathetic nerve block, for decades.
Long time, yeah.
Right. The PTSDs, anxieties, depressions, complex regional pain syndromes. Yeah. There's been there's been studies written on affecting tachycardias, anginas, Raynaud's, cold hands and feet, things like that. So the sympathetic block's been used and been researched for many different things.
Yeah.
I think what we're seeing is that now millions of people catch COVID. They come in for loss of smell and taste. They come in for some of these other things. We don't even think we're treating their diabetic neuropathy in their feet, and yet when we use the sympathetic block, the patient reports the neuropathy in my feet's gone.
Yeah.
What?
Excuse me?
Right? I don't think we did it. I didn't know we did anything to your feet.
Right.
And we're sitting there rounding, just kind of chatting about the various very unusual things that we would never have expected, and we would never have treated that person
for that.
I would have never took a diabetic neuropathy pain patient and said, let's do a stellate.
Yeah, I can totally take it.
It was crazy. Yeah. But I've seen myself that I think the most things that have stood out in my mind. I had a young lady that stood up after the block immediately within 3 minutes and could read the chart on the wall.
That's crazy.
Couldn't see. Her vision was blurry. It corrected her vision. Tinnitus, ringing in the ears, obviously tachycardias, POTS type syndromes.
Yeah.
Young girl came to me with horrible, some sort of bowel dysfunction. She'd been to doctors all over the country, had placed a feeding tube. She couldn't eat. We did one for her smell and taste, and suddenly all the pain in her gut went away. Jump forward a year, she's off every medication she was on a year ago.
Yeah.
I don't know how it fixes gut issues. Diabetic neuropathy, vision, hate to say it, multiple men have came back and told me about erectile dysfunction.
Yeah.
Haven't had an erection in 5 years, woke up yesterday.
Yeah.
Where'd that come from? It just thanks, I guess.
Shoot the old thumbs up.
Every girl here in our office has had one. Their menstrual cycles have been regulated to 5 days a month. This is just things that we would never. Fibromyalgia,
secondarily treated.
You're right. We're seeing effects,
and
I think this is really important because these are the type of things I equate it to when we go to war. When we go to war and we find out so much of how to treat trauma, injuries, blood transfusions, extremity injuries in the last 21 years of 2 wars. Well, the one good thing that's going to come out of COVID is that millions of people caught a disease. They're all seeking help in their symptoms.
Yeah.
And because they're seeking help and we're doing something for smells and tastes, we're seeing secondarily a lot of physical
improvements,
maladies reversed or improved. that's going to pique our interest, and we're going to get the scientists involved, the academic institutions. They're going to start researching, and I think we'll find that this sympathetic nervous system has more impact on the physical than maybe we ever gave it credit for in the last 50, 100 years.
For sure. It's definitely changed almost the way that I approach when I treat pain patients. You've been in pain. Most folks that come to us, it's not like they started hurting last week. They've been in pain for years and seen multiple people. Pain triggers that sympathetic response too, which again, it turns into this vicious cycle of, they're hurting, which triggers the immune response, which makes them hurt more and more, and it affects their sleep. It affects, you're looking at this big symptom tree, but the underlying thing there is this elevated sympathetic response. So it's almost changed my approach to when I assess somebody. I almost go in knowing that they're going to have some degree of sympathetic elevation, and some pathologic degree of sympathetic elevation. And and after we can do a sympathetic block, what does that look like? It almost gives you a clear picture of, now that we've taken that down, got them back down to a normal, healthy baseline, what does that pain look like? And a lot of times it looks completely different from when they walked in to after we do that. Absolutely. I feel like I don't want to say it's a good diagnostic tool, but it definitely clears the picture up of their pain. And like I said, a lot of times after doing that, some people are like, well, the pain is gone. There's not pain there, and the underlying thing was that elevated sympathetic response from whatever it is. Had a lady just this week. She had been diagnosed with some kind of heart, benign heart palpitation, heart murmur, and took metoprolol for it and everything. And hearing her talk, I'm like, okay, all right. And I'm kind of a under promise, over deliver kind of guy, and so I just said, all right, well, tell me about how your heart arrhythmia is, and I said, I'm not gonna sit here and promise you the world, I'd like to see how that is. And she came back a couple hours, and she's like, yeah, it's weird. She's like, usually, at least once an hour, I feel that it's just like a flutter in my chest. And she said, I haven't felt it. I said, okay, that's pretty cool. Still kind of knowing, like, all right, I think we're onto something here. But followed up with her, and she said she has not had a single, heart palpitation since she had that block. And, it just highlights the fact that so many things that so many people have, the underlying issue is an elevated sympathetic response, or dysautonomia. And again, this happens on a continuum. There's certainly mild, more moderate and severe cases of it.
Nothing is 100%, but and I'll be the first to say I think we need a lot of research done on this to kind of prove some of the things we see clinically happening. But you can't deny the results. And I'll also say, from a clinical standpoint, so many of these things, I didn't talk to that patient about their diabetic neuropathy when they come in wanting to treat smell and taste.
They just report it back after,
And so, I've had a lot of people go, well, that's placebo effect.
Yeah.
They just think they're better, or they want it to be better so bad. But when you never talk to them about their diabetic neuropathy, you certainly never talk to the gentleman or the multiple gentlemen about their erectile dysfunctions. You know what I mean? They came in for smell and taste. That's just not something that's
not part of your assessment.
Not part of my assessment. Okay, and so
fair enough.
The ladies with menstrual cycles, hot flashes.
Not part of what we're going in there talking about.
That's not what we were treating. We never even said this might help that. I never.
Yeah.
And yet they come back and go, what'd you do to that? Why is that gone? And I go, I don't know. I don't really know, but now, a couple of years later, it's somehow related to this overstimulation of the sympathetic system. We start getting that autonomic system back in balance, and I think we see more and more of the physical ailments that our brain perceives kind of just melting away.
For sure, yeah. So, you definitely start seeing some patterns in all this, and especially we've been doing it for 2 years, going on 2 years now.
Over 2 years. So for me, over 2 years. Yeah. So, the bottom line is, I like to tell people, don't think you're going to be stuck with this the rest of your life.
For sure.
Do not accept just because the last 5 doctors have told you, I can't help you. There's nothing. You're going to live with this the rest of your life, or just keep taking this drug. you know, it might be worth trying. I'm not saying it's absolute. Again, I love the idea is under promise, over deliver. We can't promise you that anything will happen, but it happens positively many more times than we don't see that. So, you know, if you're suffering, give us a call. Who knows what happens?
Stay tuned for more, guys. Thank y'all.